It's pretty loud in here. I'll have to mute on our end, because there was Sunday when I came in.
That a motion activated camera?
You got a whole new system here.
I see.
I don't like it because it focuses then when you're talking.
Yeah, I don't like it either.
Oh, are we gonna have an extreme close-up? Keep going, keep going.
So they're working like right here with the jail, a lot of pounding, so I might have to like mute on our end if we're not speaking to block out that, so we'll just have to see.
We hope they went to lunch.
Well, we have a quorum. I see Sarah is on, and I know there was a schedule change and there's a clinic today. So I don't know are we waiting for anyone else? I mean, I know I believe Julie said she was attending.
Yes, she did say, yep.
Okay.
Did you get my email about Paula?
I'm sorry, what was that?
Did you get the email about Paula?
Yes. Yep. So I think we should, it's 12 o'clock. Like I said, I see Dr. Heim is on, Dean is on. We have a quorum, so let's just go ahead and call the meeting to order. First things first, does anybody have any changes or additions to the agenda? Otherwise, we'll get a motion to approve.
I'll move to approve the agenda.
Okay, and I can second that. All in favor, say aye.
Aye.
Okay. Approval of minutes. Did everyone have a chance to read through the January 14th minutes? I guess I didn't see anything, but reading through them kind of triggered in my head. We need to get those bills or those claims signed from the last several months, don't we? Okay. Just a reminder. Maybe by the next meeting, whenever we decide that we're back to in-person, would it be okay to just have all of them at a chunk to sign? Or should we just, people go in there at different times to sign them?
I've just been saving them, so I just have a stack.
They're already approved, so I just put a note on them that they were approved and the date that they were approved.
Okay. All right. Otherwise then, anyone have any questions about the minutes or want to go ahead and make a motion to approve?
I'll make that motion to approve.
I'll second.
All right. All in favor of approving the minutes as stated, say aye. Aye.
Aye.
All right. Set date for the next meeting in May, which, you know, knock on wood, potentially could be back to in person. We'll see how it is. Does anyone have any conflicts on the second? I'm bringing up my calendar to see here.
Like the 13th or 20th.
Yeah. Carrie, is there any Carrie or Sarah, any conflicts with you between either the 13th or the 20th that you're aware of?
Can you guys hear me?
I can now. Yep.
Oh, okay, good. No, I think that'll be fine. Thank you. Whatever date.
Either
Okay.
one's fine with me also.
I'm okay with either one.
Okay. Well, is the 13th okay with everybody?
Sounds good.
Okay.
Sounds good.
All right. Meeting set. All right. Let's go ahead and move into public health nursing. Sarah.
Okay, can everybody still hear me? Sorry, I feel a little scattered. Okay, so and did everybody look at the financial reports that Megan sent out on that? One thing I do want to point out is we are collecting a co-pay, or it's a administration fee, and we are charging people's insurances, but the person themselves do not have a charge at all. Currently, for their first vaccine or their
Oh, that's from that blanket. That's it. Was it on your shirt? Could have been on your leg? Okay. It was on that. It needs a new,
A lot of feedback.
dollars.
Dr.
For
Burns,
that.
could you mute yours, Dr. Burns?
Yes, I will. Sorry.
Okay, so currently effective March 15th, the administration fees did increase from $28 to $40, and then from $45 to $80. So basically, each vaccine now that we give, we can be reimbursed $40 per administration fee. So that's a good thing. Another thing is currently
Just have the certificate.
this
instead of the-
stuff I did get off of the coronavirus.iowa.gov
Well, I mean, she ended up putting this off this
website.
right in here, and so
For
vaccines. You don't see that. I was come back and put it in there.
All right. Hey, Julie, can you hit mute?
Okay. You must forget. Are these new
Art
papers?
and Julie are
Okay.
both on.
Yeah, kind of. Yeah, we had them last fall.
Okay.
So,
Julie?
yeah.
Julie, oh, thank you. Okay, go ahead, Sarah.
Okay, sorry. Okay, so I got this information off the coronavirus.iowa.gov for how many vaccines have been initiated, the 2-dose series, 2-dose series completed, and single dose completed. As of today, initiated 2-dose series, which includes Pfizer and Moderna, 1,858 total. 2-dose series completed is 2,897. And single dose completed, which is the Johnson & Johnson, would be 100. So total doses administered is 7,767 doses so far. Now, keep in mind today, we are doing 500 doses of the Johnson & Johnson, or the Janssen vaccine, which is made by the Johnson & Johnson drug company. So that's going to increase our single dose completion. It does not have the 300 doses that we received from IDPH with Moderna. So these numbers are up just a little bit. It takes them probably about a week to just get caught up. I also do want to say that I have been pretty much begging the state to give us more vaccine. I asked them to give us 1,000 doses of the Pfizer vaccine so we could do a mass clinic. I talked to Ken Sharp. He is the lead person on all this vaccine. He told me that the state of Iowa did not receive the extra 3 boxes. So I'm not sure how much is in a box, but they did not receive the extra 3 boxes of the Pfizer vaccine that they were supposed to this week. So therefore, their Pfizer shipment did not increase from last week either. The Moderna shipment is not increasing yet. And the Johnson & Johnson will not actually be available to public health until I would anticipate the first week of April. I've been doing everything that I can in my power to beg the state for more vaccine, but we're not getting it. It's frustrating as I was hearing on my way home that Webster County received 1,200 doses of Pfizer because the governor went and saw how good their mass clinic was going, which frustrated me. So I asked him, hey, give us a chance to show you how well we can make it work also. And again, we're not getting the vaccine shipment because IDPH isn't getting their increase. I have reached out, just maybe planning and wishful thinking. I've reached out to Kemper to see if we would maybe be able to use one of their facilities, whether it be their gym or the field house. If we would end up getting a lot of doses to do a mass clinic. The people I've talked to, they've responded enthusiastically. Without a doubt, they would help us out. They would let us use either or facility, which is great. At least I know we have a facility such the vaccine allotment arrived to us. We aren't getting a whole lot in, so we really can't allocate out to the 3 other clinics. It's a frustrating thing. I heard on the news the other night that 95% of the 65 and olders were vaccinated. I don't think they were counting Carroll County, because I know we don't have 95% of our 65-year-olds and older vaccinated. So I'm not sure where those numbers are even coming from, because I believe the governor also used that statistic in her press conference. So I'm not sure where they're actually getting all that information from, but it does not appear to apply to Carroll County.
What percentage do you think you're at, Sarah?
If I had to guess, I would say 35, maybe 40%. I mean, we're not with 300 doses only a week. That's hardly a drop in the bucket. Whereas we're an old county, we have way more residents in the 65 and older category than we are getting the vaccine.
Sarah, I would think even that's almost a generous percentage, because I would wager that we're not even, McFarland Clinic's not even through half of their 75 and older population.
Yeah, it's so frustrating that I don't know why all these counties around us seem to be getting as much allocation as we are, but we're sending our residents out to them. So why not send the vaccine to where the residents are? Why make the residents drive somewhere?
Sarah, do you get statistics on how many people are going outside of the county to get vaccinated?
No, I don't have that statistics. I mean, I can look on the coronavirus.iowa.gov map and it'll show like, I don't have it pulled up right now, but it's pretty much, it says residents given by the county who basically aren't a resident of the county. It's kind of broken down, but it doesn't say Carroll County specifically of how many have actually gone out of the county.
I think that'd be kind of a hard one to track anyway, because they got the retail pharmacies and then you've got the clinics. I would say that even when we're calling, I would say the 75 and older crowd is more apt to stay locally because they don't travel quite as well. I think the 65 to 75 has a lot more opportunity to go outside of the county and get things. I mean, because you can go to Hy-Vee's, you can go to, a lot of those retail pharmacies. So I think a lot of them are taking advantage of that. But the problem is now that they've opened it up to anybody with a comorbid condition, I mean, the supply has now been diluted further. So I think that older crowd is having a hard time getting access.
Right. Well, and according to Governor Reynolds, this, what is it, second week in April, it's going to be opened up to everybody. And I don't know if we're actually going to get the vaccine to be able to do that unless they start giving huge amounts to us. There's no way we're going to keep up.
Becky, would you like to me to interject what I've learned?
Yes.
Okay. So there was some frustration that I had at the beginning of the week. My mother-in-law participated in a mass vaccination in Monona County at the Ottawa Hospital of 1,200 people. And I was wondering the same thing as you were, Sarah, why aren't we doing that? And so I reached out to Heather Bombay and she got me in touch with Ken Sharp. Ken sent me an email on Tuesday afternoon with a chance to visit with him on Wednesday morning. And so, I expressed the same frustration that we're having here. And he said that in his email, and I can send that to you as well, Sarah, and to the rest of the board as far as that's concerned. But he said that according to the Carroll County's population, of 0.63 of the total population in Carroll, in the state, that Carroll County was getting 99% of their allocation. And I disputed that. I gave him what statistics that I had about 20,000 in Carroll and less than 10,000 in Calhoun and Sac County. I also, in our conversation on Tuesday morning, I expressed that according to Region 12 Council of Governments and studies that they do, that the 65 and older population in Carroll County is 25%. So if we have 25% of our people are 65 and older, that's 5,000 people. That's half the population of the counties north of us. So I said, this doesn't square with me, how we're not getting any more vaccine. Now, as far as he did say, and thanks to Heather, she did some research on this as well for me, that the vaccination clinic over in Monona County came from Cass County, and it was a Rex pharmacy there that had the extra doses that went to IDPH, and they asked them where they could hold a mass clinic. Well, they chose Monona County simply because they did not have a pharmacy there. And so that was one of the reasons why they chose Ottawa Hospital and Monona County. So to cut this short, and if anybody has any questions, I'll be glad to answer them. But he, at the end of our discussion on Tuesday morning, he said, Dean, you're one of 12 counties that expressed frustration over this. We will be getting you more vaccine in time. Have you heard anything like that coming from him, Sarah? He says, we will give you more vaccine in the future. So
he told me that in the next 4 to 6 weeks, there might be an increase in allocation. Like that's a long ways. That's a month and a half away. That's
so when did you talk to him? Yeah, when did you talk to him last?
I talked to him, what is today? Thursday, Tuesday. Tuesday, I emailed him again because he never responded to my second email to him, so I followed up. So it was Tuesday.
Okay.
When I talked to him.
I talked to him Wednesday morning.
Or emailed
and so
him.
Maybe since then, since you had talked to him and I talked to him, maybe we might see some release. He thought that if there was any overage, we would get some. Now, I'm not saying how much, and what you're talking about, the breakdown of the containers and the doses, I think it's 100, and I think a case is like 1170. And so that's where the 1200 comes into for these clinics. So I don't know anything about it, but I'm hoping that we can get an increase. I was frustrated. I'm glad he contacted me. We had a very good conversation. And so I hopefully that we can move ahead with more vaccine. So that's my input.
Just a quick question, Sarah. If by chance you get notified tomorrow or beginning of next week that you're going to have a dramatic increase in an allocation within the next 7 days, are staff lined up to be able to help with a mass distribution? Is that something that county dollars need to assist with, to have additional nurses or people to give the shots?
I have talked to Manning and McFarland. I talked to Sue with McFarland. And they're all on board. Yes, if we get a huge increase in allocation, we will have all clinics and entities coming together and helping out to get this thing off the road, because we're only going to have a few days to actually literally logistically plan for it. And it has to be done within that week, because otherwise we won't get any allocation for next week, because we have to meet an 80% burn rate every week in order to keep getting allocation. So that's why it's like, okay, tentatively, we're going to be planning for a mass vaccine clinic. That's why I want my ducks in a row to make sure that everybody is on board and we can make it happen within a few days is what's going to happen. So So
You
yes,
haven't
I
had any
believe, and
trouble
if
getting out
county
with-
dollar, what's
There-
that, Dr. Heim?
You haven't had any trouble getting the 80% threshold, have you? People have been getting those
No,
vaccines pretty
yeah,
quickly.
we're 100% every week. Every week we have 100%. We have no problem getting rid of it. Oh, there was another thing I was gonna say. Oh,
County
Becky, yes,
dollars?
if like county dollars, yes. If there's something there that can help us also, that would be great. You know, I just, until we can actually put it all together to see where we're going. I know our public health budget has kind of been blown out of the water because everyone who helps us with the clinics within our, with our CCPH clinic that we do on Thursdays and Fridays does go to our public health fund. So yeah, any county dollars that can be sent our way, we would appreciate them for these mass vaccine
Well,
clinics. Once
Yeah,
do
we should
feel
have a conversation about that, Sarah, because I believe I can help you with that, you know.
I do
Great.
know that McFarland is prepared and ready for whatever. So, I mean, if we get 1,000 doses and we need to get it in arms, we have capacity and space that we can run clinics all weekend because we have the urgent care open. So our facility would be available if we need to get that in as well.
right, yep, exactly.
So
So
just
Sarah,
a comment, I don't know.
So Sarah, just let me know if you
Just a-
need anything, and Sarah Anderson, you can talk to that as well.
Thanks, Dean.
So I watched the governor's conference yesterday, and she had that Webster County public health lady on there, and then I made some notes. So the workshop or the vaccine event that the governor went to, they were doing 180 shots per hour, and their goal for today was 300 shots per hour. So the question was, well, who did you all use? And she said they used retired nurses, school nurses, healthcare nurses. They got local service group. They had members of the Board of Health there, Board of Supervisors there. They had the Fort Dodge Fire Department there, and they had others in the community volunteering to help. So that's why she was giving her that another dose of 1,170. That's what you get if you get the big vial is what they call it or whatever. You would get 1,170. So at 180 per hour, that would have taken them 6.5 hours. But at 300 an hour, they're going to get that done in 4 hours. So if we were to get in 2 weeks in April 5th, if they start sending everybody the 1,170 vials, the big ones, because that's what Biden is promising, is that 20 million doses are going to start shipping on a weekly level. Are we ready to do 100, or you know what I mean, Sarah, in your opinion, are we at that 180 per hour rate, or are you thinking the 300 per hour? Because I just think there's some coordination that needs to happen. There's a lot of groups that she seemed to pull together for that.
I think for sure we could do 180, 200 an hour, no problem. And then once we get more, whether it's retired nurses, volunteers, whomever else to give vaccines, I think we will be able to do that also. And it's just a matter of reaching out to whether it's the police department to help with traffic control, the fire department to help with seating and sanitizing. And I'm sure like school staff would help us, because I would plan on doing these on like a Saturday, so most people can come in for the vaccine.
Do we need to have somebody putting a call out now to retired nurses to put the bug in their ear that if you're interested, give us your name so you can be on standby so that we can contact you?
That's a good idea, just so we can start getting more ducks in a row. So we know, okay, we're going to call this person, the first 10 people we need, and let's reach out to the Carroll Fire Department and say, tentatively, this is what we're hoping. Would you be able to help us? The same with the police department. Would you guys be able to help us with traffic control? And I think the fire department can do that too, right?
Sure.
Yeah.
Okay,
I just wonder, Sarah, because you've got so many clinics on your plate right now, is this Sarah Anderson, would you have capacity to help kind of with that behind the scenes coordination to assist with that?
I can help with anything. I just feel like we need a plan in place, especially if they announce, yep, you're getting 1,170 next week, you know. I just want to be able to, if Kemper's on board for saying yes, field house, then, you know, what does that look like? Where are the chairs coming from? Where are the tables coming from? Where are the, you know, how is it going to work? Because it's still a lot of stuff to coordinate.
Well, one thing, at Webster County, they use the Crossroads Mall, which has a lot of parking, and it's under renovation right now. So that's the reason why they have the big space and they have the large parking area. So would Carroll High be actually a better spot if we needed a large parking area? That
I
would
have
be
a real
my
quick question. So this vial you're talking about, so it's every single dose is in a single vial? They're not multi-dose single vials?
We just know that when they do these big clinics, they ship them 1,170 doses. It's
Okay, because
I think they have to draw them all up.
Yeah, because I know when they do our clinic, they draw them up. I mean, you gotta only have so much time that they can be, you know, drawn up, but then they have people drawing those up and then distributing them. So I'm just saying, you know, if it's coming from a single, I mean, I think that's probably going to be one of those situations where you could definitely utilize different facilities because you need the space. You could get a lot more into people if you have, because I know even at like McFarland Clinic, they use a whole section, but we had even talked, we have like on the weekend, we have almost the entire clinic available. So we could use even the seating that we have in the main lobby part. So you could be vaccinating at the clinic, at the hospital, at the school, all at the same time, and then you can get more people through. That's why I was wondering how the doses arrived, because it's a little harder to do it if you've got, you know, one big vial and not.
I don't know. We just heard the number. So
I
Sarah,
think it's the 10 dose vial. So you're going to have to draw, you know, 10 times. And Sarah Anderson, question that
you're saying
had,
you get 117 10 dose vials, Dean? You think it's 117 10 dose vials?
yes, that's what I understand it to be.
So Sarah Schulte, to get to 180 per hour, 200 per hour, how many nurses are giving shots?
But my question is, if they're in those multiple vials, you don't need to do it in one day. I mean, you can distribute that over 3-4 days.
And a question that I have for you, Sarah Anderson, do you know if these mass vaccinations, like the one in Ottawa, you had to make an appointment. So, you know, my mother-in-law's appointment was at 11:30. So she was there at 11:30. So I'm sure that these all, I mean, you can spread out 1,100 or 1,200 over the whole day. You wouldn't have to, you know.
Now, even the one in Webster,
it would be
County, it was
by
by
appointment
too.
Yeah, because
you don't want to have by appointment.
200 people standing there waiting.
Right.
They can only be on thought for so long.
Just one question to break in there. I thought I remembered last year around this time signing an agreement that Carroll Public, you know, high school or middle school had agreed to serve as a mass vaccination site. Is that still on? I'm sure I signed something.
Yes, you did. Correct. And this didn't actually come from the school themselves, but I heard that Carroll High is very protective of their gym floor. And apparently and I'm not sure, someone can maybe help me out if they know something about possibly having the girls take the shoes off for prom because they don't want it scratched up. So I'm not sure how that works.
True.
But, and I could always, you know, we could always put tarps down and stuff or anything, but so I mean, yes, I can reach out to them also.
But are you saying, Becky, that since it's signed with Carroll High, that's where you think it should be instead of finding a different location?
Oh, no, not at all. I just wanted to see if there was a change of heart or, but no, it doesn't matter where, whoever is willing to host it and has the space and it's, that's where we go.
Carroll School District has more than one gym, so even if the high school wasn't available, you got Fairview that's got 2 gyms, and you've got the middle school.
Which is
Well,
true.
I would think that, logistically, you'll have to figure that out, but, maybe maybe Farland Clinic is just fine. I'm just thinking about, traffic out front with cars and stuff like that, having a parking area that's big enough. But if you're doing it by appointment, you can spread those out.
Well, I think a lot of it depends on how you
that's manageable.
doses. If you can distribute them over days instead of hours, I think it's very easy to do. But if it has to all be utilized in, a day's time, then if we got a bigger problem. But I think just what we have in place now, and Sarah, you can correct me if I'm wrong, but I know you guys have been asking the different clinics, what their capacity is. But I think that it's been overwhelmingly positive that most of these clinics think that they can handle it. You just have to tell them when and tell them go.
Right, which is when we get more vaccine. That's the most ridiculous part we're running into is we just don't have the supply. And again, it comes back to frustration. We get people, and you guys, I'm sure Dr. Heimer, are getting a lot of people calling and complaining, and why does so-and-so get it? And I should have had it because I have this and that. And I agree with them, and it's frustrating, and it's, we just keep asking for people's patience because we don't have the vaccine.
How soon is the next preparedness coalition meeting? Is there one tomorrow?
For the county-wide or for just the small group?
Just the small group.
We just had one.
Okay. I was gonna say if this could be something that could be hammered out, any additional support to make a mass vaccination occur, just would be a suggestion.
Yeah, we can coordinate via email, but we just had one and they're only scheduled for once a month right now, just because Sarah's so busy.
Okay. Well, I would just say, Sarah Schulte, whatever that you can offload to have others help out with finalizing these plans, just so that if, by chance we hear on Monday that, oh, hey, we've got all of a sudden the vaccine coming, so that it's not so much on your shoulders.
Sarah, are you doing the weekly updates on the radio? I think I hear those. Right?
Yes. Yep.
I think that might be a good time to just kind of put the bug out. We're hoping to get more we're hoping, and if there's anyone interested in volunteering to administer doses, maybe contact the public health department so we can get them on a list so we can call them if we need them. That might be a good time to.
Yeah, we could definitely do that. Good point.
Sarah, have you heard what our allocation is this week yet?
I believe it's 300 again. I'm trying to think. No, wait, let me think, because I have so many numbers in my brain. I think it is just 300 again that we are getting.
Are we still on tier 1, or are we off of tier 1?
What was that?
Are we still on tier 1, like the teachers and the firefighters and them, or are we past them yet?
No, we went to tier 2, which is manufacturers, food distribution, which, just to remind everybody, food distribution does not include grocery store workers or restaurant workers yet. So that's frustrating also. And then it also includes agricultural people, but it's people who cannot social distance at work. So, I've had some co-ops call and say, hey, I would like to get my people in. I said, well, you can only do the ones that can't social distance. So like your truck drivers and the feed delivers, they're not eligible quite yet unless they meet by age, the age. So yeah, we're on tier 2, 1B.
Sarah, did you say you have a clinic today and you got 500, you're giving 500 doses? Did I hear that right?
Yes, we're doing the Janssen vaccine, which is the J&J. We have 500 that we got, which the governor was doing. I'm not even sure how it came about. But she was working with all Pella corporations across the state of Iowa. So that's how we were able to get the 500. So we're mainly working our way through Pella and Farner, and a few other smaller businesses or companies in town.
Okay. So, I mean, you're not, I mean, you have some experience with mass vaccination type of program.
Right. Mm-hmm. Yeah, I would say like every clinic that we do, and Dr. Heim, I know there's, however much we can give them. I mean, we're all doing bigger vaccine clinics, so it's just a matter of adding people into it.
I think it's a very good discussion, very forward looking. Just to add on to some of my thoughts there, I think Dean is right. It should be coming as multiple vials, just for sanitation purposes, having 1,100 or 1,100 or 1,170 doses in one vial. You could have too many needle pricks and also be concerned about contamination. Dr. Heim's comment about having multiple locations and not all on the same day, I think I like that thinking. And that also, if you multiple locations like Manning and Coon, the people will not have to drive quite so far for those to get their vaccination, and would lessen the congestion in one mass clinic as well.
Good thoughts there. Anybody have anything else related to the vaccine? Any questions for Sarah? Otherwise, if you want to just go into what our cases and other COVID updates.
Oh, let me pull them up here real quick. Hold on. I didn't have time quite this morning to look at them, but I can get them pulled up really quick. Okay, so currently, our current active cases, I had to get to the right day, hold on. Okay, our current active cases is 5.1. Just to maybe give you a little bit, on March, let's just go March 1st. On March 1st, our 14-day positivity rate was 2.9. And currently we are at 5.1 as of today. That's kind of the biggest number I have available.
I will give you some just personal perspective. So it was very quiet for about 2 weeks where I was having hardly any positive cases. And then we've seen a little bit of an uptick. So we started having a lot more positive. I had 6 last Monday, and then I had 5 or 6 again this Monday. It had calmed down a little bit, but then kind of started perking up again.
Yeah, I noticed that as well, that by Tuesday, we had like 33 positive cases in the last 7 days. And then the 7 days prior, it was 11 total. So that was a little concerning. I just wondered if the last couple of days, if the numbers have continued to increase or if they went back down.
Carrie, are you able to give an update on how many were put in a spreadsheet today? Because I think yesterday there was 1 or 2. Do you remember?
And 4 today. It's definitely back up to more than 1 a day. We're at 4 or 5, 3. So I think there was 4 that went in today.
All right, so definitely something that we kind of got to, keep a track on the next week and, see if we're if we're accelerating too quickly back up or anything like that.
What I think is probably the biggest concern is a little bit of the complacency that people are having. I think people think, yeah, it's gone. So I think, and not that, I mean, vaccines are helping, and having had people that were previously exposed, I think is making a big difference. I mean, at the end of the day, we're probably not going to eliminate this process. We just need to protect the older group of people. I mean, I will say the people that I've seen that have had it haven't been quite as high risk lately. So that older population has been vaccinated a little bit better. So hopefully that will keep the hospitalization numbers down, because that's, getting COVID is one thing, but being in the hospital is a total another. So if we can keep people out of the hospital, which is one of the benefits of the vaccine. So even people that are vaccinated that get it are less likely to be hospitalized. So that's, at the end of the day, kind of our chief indicator of a process. And I know early in the week, now granted, they tend to follow us about a week to 2 weeks after we see them, then they end up in the hospital. So when I was talking to, I think there was maybe one person in the COVID unit earlier in the week. So that's, hopefully will stay that way, but time will tell.
So Dr.
And I do
Heim,
wanna
Dr. Heim, are you calling your patients, the oldest first and then on down the line? Is that how McFarland Clinic's doing that?
Yeah, for the vaccine?
Yeah.
Yeah, they started from the oldest and worked its way down. I mean, I know we had over 2,000 patients in the 65 and older alone that we needed to get vaccinated in that group.
So do you know what age you're at right now?
Last week, I think that they'd kind of gotten down to about 80.
So you're down to 80.
Yeah.
Wow.
I don't know if they've broken that threshold yet. They might have. Because some of the problem is they call these people, and then some of them don't call them back right away. They give them a message, and then they have to call back, get back into the queue. So I had heard that they had called a bunch of people and that they hadn't scheduled, and then they had a whole bunch of people call back in to get back on the line. So I hope they've broken the 80-year-old threshold, but they hadn't as of last week.
Dr. Heim, what's the status on the younger people that are immune compromised or have health conditions? Are they contacted as well, or are you just starting from elderly and working your way down?
So it's a tricky balance because, to be honest with you, in my experience, I've seen that age alone seems to be the biggest risk factor. I mean, other people with underlying health conditions can sometimes do more poorly with COVID. So we, with the advice of our infectious disease physician in Ames, have decided to go from age down. And so that way there's no politics and people don't feel like they're being, because I mean, it's very difficult when you start allowing the doctors to decide whose patient is sicker. It definitely becomes a very difficult process. If we were getting more vaccine, we would probably start allocating to those patients. But right now we're just trying to get the oldest to the youngest. And then once we hit that threshold, then I think there'll be a little bit more room for maneuver. I will say that because the retail pharmacies have those vaccines available to those patients, I think what we're doing is trying to get those patients there. Most of those people are still fairly mobile. The higher risk ones, the ones that are in like New Hope and that sort of stuff have been vaccinated. But, right now, because we just don't have enough to get the older population, we haven't been able to move on to that group yet. We haven't even been able to get all of our 65 and olders done yet. So we haven't moved into the comorbidities. So what we've done is we've encouraged those people, and we've had those people call to the clinic, and our office manager will get them into clinics. So there's retail pharmacies in Calhoun County that also are getting vaccine. I know of 2, I think, pharmacies. Is that right, Sarah? 2 pharmacies in Calhoun County that are giving them out?
2 or 3.
Yeah. So, they've got buku vaccine in Calhoun County and not a lot of people to give them to. So that's where, and I think Hy-Vee is able to give those to people that have comorbid conditions that are 65 and under. So a lot of those people are being directed there. So.
Okay, thank you.
We're also sending people to Crawford County because they have openings in their schedules too, just to let you know. I want to touch base real quick on the variants, the new variants that are in Iowa. Currently, there are none in Carroll County. We would know as a public health if we would, because we would normally do the normal first DOMO case investigation But then a week or so later, we would also get notified by IDPH that we have to do another case investigation that the CDC wants us to do. So currently, we have no new variants in Carroll County.
Hey, Sarah, I was going to ask you about that. How are they telling? I mean, because I'm not doing hardly any PCR tests.
Well, I think what's happening is if someone who's recovered from COVID completely, but within the 90 days tests positive again, and the physician or whomever it is feels that they should be, that the variant should be checked for, that physician has to contact IDPH to run a variant check on them.
Yeah, because I know the state hygienic lab is doing that. And I think
right,
they're
and I think
on all their PCRs now, maybe, are they?
Okay, I know there is a criteria that they have to meet in order to be able to test for the variants. So it has to do with travel, have they tested positive within the 90 days they've recovered, stuff like that.
And I know there, previously there was criteria to go to the state hygienic lab. They lift that criteria so anybody can get tested through there. But I know they've also lifted the criteria. I can request a DNA variant on anybody. I think. I don't think they have to meet criteria specifically. Like if I have high suspicion, I just have to ask for it. But my question is that when we're doing our initial screens, we're only doing antigen testing. We're not, if they're positive, I'm not sending it for a PCR. So there's no additional testing beyond that. So I'm questioning how significant that statistic is.
Right.
I don't want to burst your bubble.
I guess, no, that's okay. But the other thing, I guess, is if you feel, then I guess you guys as a physician would just have to swab a PCR and say, this might be a weird little variant. So I'm not sure exactly how accurate it is. That's just like everything with this. How accurate is all the reporting that we're getting currently?
Yeah. How are they doing
more
their
than that?
PCR tests at the hospital? Are they sending those out for confirmation? Do you know?
I do not know that.
Okay. Because I know they do a lot of rapid PCR tests. I was just wondering if they did send out any of those.
Right. I'm not sure. They might. I'm not 100% sure on that. I can get back to you though.
My guess would be that this variant statistic is a lot like influenza. When they say, oh, we had our first confirmed case of influenza, when you know that you've already, seen how many people that have had the flu, but just haven't tested for it. I just wonder if the variant, that's a difficult statistic to really believe.
Right. Well, that's even like, we look at the case numbers in Carroll County, we know they're way higher than what they are right now for people who've had COVID because not everybody gets tested for them.
Becky, you just brought up influenza. Dr. Heim, do you know what, how many cases of influenza we've seen in Carroll County this winter?
I don't know that we've had any confirmed cases. I mean, they've had a couple of rapid tests that have tested positive, but I mean, beyond, and it was influenza B of all things. Usually you get A first, but we've tested one positive patient in our clinic, and that one I would say is suspect. So, I mean, I would say 0.
Okay. Thank you.
I don't want to cut it short, but they're going to start drilling again on this wall behind us, and we're not going to hear anything. They gave us about 15 minutes, so if we can speed it up a little bit. Otherwise, we're going to have to move somewhere else.
I also have to get to another COVID vaccine clinic quick. Is there anything else for me?
I can't think of anything other than, just, I know it's still crazy in a different way. So if there's anything that Sarah Anderson or anybody Preparedness Coalition, to kind of help with getting that coordination, even of the extra volunteers, of the retired nurses, I think we have, a network there that can definitely help so that that's not all on your plate, Sarah, to be taking phone calls from retired nurses or to try to keep track of stuff like that. So anything at all that, just as a reminder that there's more here, you know, that we can help. And Dean, if you'll look into the county dollars that could potentially assist with paying for some of this staff time.
Yeah, there's a lot there. I will tell you that. So don't be afraid, Sarah, to reach out for more money. Okay.
All
It's
right,
there.
that sounds great. Thank you very much. I appreciate it. And Sarah Anderson, I'll probably be in touch with you to see how we can get more people coordinated on if this vaccine clinic happens, that we have everybody in place.
Yep, because instead of giving out your phone number and your email, just replace it with my phone number and my email, because I can make those lists and I can keep track of those people instead of having you do one more thing. So.
Sounds like a plan. Thank you very much for all your time. Anything else?
All right.
Okay,
Thanks, Sarah.
Everybody have a great weekend. Bye.
Bye.
Keep up the good work.
Yeah, thank you, Sarah.
you.
You're doing a nice job.
You're welcome. Thank you. Bye.
Okay, new opportunities. I don't think we have anybody online. Okay, so we will just move into Carrie with environmental health.
Okay, and I only have the monthly report from January, February, which I emailed all of you. Did you all get it? Yes. There's questions about that. I mean, obviously January, February are slow months for us. So if you got questions about anything that's on there, give me a call. The only other thing is the claims that I have from February. I sent you those as well, and I would just need approval for those.
Hey, does anybody have any questions for Carrie?
It just looks like things are picking up a little bit for you, Carrie. Yeah.
Yeah, it'll pick up.
There's probably a lot of work out there to do yet.
Yes.
If nobody has any questions, we want to get a motion to approve claims.
I'll make a motion to approve claims.
And
Okay,
I'll
anybody?
second that. This is Julie.
Okay, all in favor, say aye.
Aye.
Okay.
All right, is that it? Anything else, Carrie?
No, I'm good for now.
She says, come on, hurry up. I don't want to hear the drilling. So, okay. We should use this excuse every meeting. They're going to be drilling. Go. Okay, Megan.
All right, so I sent my monthly reports and claims for January, February. So you should have gotten those. So any questions on those? Otherwise, all I have is some donations to run past to approve. Well, I guess I'll need to get the claims approved as well.
Okay, anybody have any questions on Megan's claims? Otherwise, if somebody wants to make a motion to approve.
Motion.
I'll make a motion to approve.
Okay, Dr. Behrens, have a second?
I'll second.
Dr. Heim? Okay, all in favor of approving home care aid claims, say aye.
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 All right. Donation, Megan.
I got, heard back from United Way, from the grant application, and they, gave $1,500 for this year. And they do it all in one, it used to be 2 separate times that they allocated out, but it's just one. So I got the full $1,500, from United Way. And then I got, heard from Manning, and they gave $1,000 this year. That was awesome.
Who was it that gave 1,000?
The Manning Community Chest.
Oh, awesome. That's a high amount, isn't it?
Yes, yep.
Very nice.
I'm the president of that, so thank you very much. We had a good year considering, you know, coronavirus. We had a goal of 10,000 and we made 13,000, so we were really happy.
Awesome.
That's awesome.
Yeah.
Well, thank you, Julie, for your persuasion there too.
Yeah, I have a big push.
All right, I think we have to technically make a motion to accept the donations, correct? Okay. Somebody want to make that motion?
I'll make a motion to accept the donations.
All right. Any second?
I'll second that.
All right, all in favor, say aye.
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 All right,
I know.
well, cool. Does anybody have anything else? Ooh. Heard a big bang back there. Otherwise, I guess we can probably just have a motion to adjourn.
I'll make
Also
a
move.
motion.
Okay, in a second.
I'll second.
All right, 12:54, motion to adjourn. All in favor, say aye.
Aye.
All right, good deal. Good
I never
meeting,
thought
good.
I never thought we'd get done in an hour today.
I know. It didn't look real promising there, for the
No.
first 80%, but
Hey,
no,
Dean,
this
I went on